Charmaine Cadenhead Harriet and Carolina Caba to present Module 3.
In this module, we'll be talking about getting to know your new baby. It's time to eat. How do you know your infant is ready to eat? Thankfully, your little one will show you feeding cues. What are those feeding cues? Stretching, stirring, rooting by turning head side to side, putting their hands in their mouth, licking their lips, or making sucking movements of their mouth and tongue. Crying is a late sign of hunger. It is important to calm your baby first by gently rocking or doing skin to skin with your baby. It's time to stop. How do we know your baby has had enough to eat? Your little one will let you know. Your baby will release your breast on their own, or they will fall asleep. Their arms and face will become relaxed, and their lips will stay closed. They will turn their face away and no longer search for the breast. Getting your baby to latch and position your baby correctly is essential for successful breastfeeding. There are many different positions you can use to breastfeed, but don't worry, our nurses are trained to assist you with this. When your baby is first born, usually leaning back is the most natural position for your baby to latch. Other positions include the cross cradle hold, the football hold, which is good after a C-section, the cradle hold and side lying positions. With breast and the breastfeeding position that you choose, it's important that you are in a comfortable position with back support. Baby is skin to skin. Baby is facing you and close to the breast. Baby's ears, shoulders, and hips are in a straight line. Always bring the breast, not the breast, to the baby. Baby should be nose to nipple, and when baby opens wide, like a yawn, bring the baby in quick and close to you. Chin touches breast first, and the nipple is pointed up towards the roof of the baby's mouth. But don't worry, this takes time and practice to master. You will receive assistance as needed with your breastfeeding experience. And now let me introduce Carolina Caba, who will discuss frequent concerns and questions.
Hello, everyone. My name is Carolina Caba, and I want to talk about one of the most common questions we get from our patient. How do I know if my baby is getting enough? First, please trust your body and remember your breasts were made to feed your baby. The best way to ensure your baby is getting enough is by keeping track of all your baby's feedings and wet and dirty diapers. Simply, if nothing goes in, nothing comes out. Babies should be fed on demand or whenever they're showing feeding cues. But we must make sure that there are at least 8 to 12 feeds each 24-hour period. When you look at the slide, you will notice that each 24-hour period, your baby's wet and dirty diaper should increase and the stool should change color. The first day of life, the stool is black and there should be at least one wet diaper. By the third or fourth day, we should see the change to a brownish, yellowish color, and there should be at least 3 to 4 wet diapers. Logging the feeds is very, very important. It helps us to keep track and make sure the baby's getting enough. And when you get to the hospital, we'll get you a log that tells you what to expect each day of your newborn's life. Now let's talk about some other questions that we hear a lot here in the hospital. One of them is, when should I start breastfeeding? Start as soon as possible or whenever you are able to. And please, don't worry if your baby is not latching each time. In the first 24 hours, offer your breast at least 8 times. Let your baby safely skin to skin and try to latch every time you see the feeding cues. It is a good idea to ask your nurse to teach you hand expression, which definitely aids with the latch. How long should a feeding take? Or how do I know the baby is done? I will say, don't watch the clock. Pay attention to your little one. Don't limit the time on the breast. Let the little one tell you when he or she is finished. Baby will self-detach from the breast and will look content or sometimes even asleep. Should I offer both breasts? Absolutely yes. After the baby is done with the first breast, attempt to burp the baby. Then maybe even change the diaper if needed. and then offer the other side. It is absolutely okay if the baby doesn't want the second breast, but always offer. And then the next feeding, start with the one the baby did not take. How do I know baby is getting anything? Trust that your body has what your baby needs. Moms sometimes feel uterine cramping, which is very normal. Thirst and sleepiness when the baby is breastfeeding well. Learn to look and listen for swallowing, and always keep a track of the baby's wet and dirty diapers, along with the numbers of feeds in a 24-hour period. Should I wake up my baby to eat? The first 24 hours, you should make frequent attempts of putting baby to the breast and practice safe skin to skin. After the first 24 hours, baby should be waking up without help to breastfeed at least 8 to 12 times each day. If the baby is sleepy after the first 24 hours or not feeding the minimum of 8 times, that is a warning sign, and you should probably call your nurse or contact your pediatrician. You are encouraged to come back to watch this module again as often as you need, especially once the baby arrives, to help reinforce what you have learned